SimMan 3G is a full-body, high-fidelity patient simulator used at the University of South Dakota Sanford School of Medicine's Parry Center for Clinical Skills and Simulation. The simulator can be run by an operator in the control room or can be programmed to automatically react to the learner's actions without operator intervention. Vital signs are displayed on a touchscreen monitor. The main vital signs that will be displayed are ECG rhythm and rate, pulse oximetry, respiratory rate, temperature, and blood pressure. To display the vital signs, simply touch the area where the waveform will be displayed and it will appear. In order to check blood pressure, simply push the start-stop button once and the blood pressure will cycle. The blood pressure will not recycle automatically. You will need to remember to reassess the patient's blood pressure throughout the simulation. The simulator also has the capability to do a manual blood pressure, allowing you to auscultate with your own stethoscope. The SpO2 will be displayed once the saturation probe is properly affixed to any one of SimMan's digits. SimMan has numerous heart, lung, and bowel sounds, all of which are made easier to hear by using a feature called auscultation focus. The operator in the control room will stop chest wall movement to eliminate any mechanical noise, which will allow the learner to focus on the intended sounds. If the oxygen saturation reaches below a hypoxic threshold, a small blue LED light will illuminate the oral cavity, simulating cyanosis. When a pneumothorax is present, breath sounds will be diminished and chest rise and fall will be minimal on one side. The pneumothorax can be corrected by doing a needle decompression, resulting in a small rush of air with automatic bilateral chest rise and fall. The mannequin will respond with improved breath sounds and oxygen saturation. In the event of an apneic patient, you can assist ventilations by using a bag valve mask. It is important to ensure you're getting adequate seal and introduce the proper amount of air volume into the lungs of the simulator. If ventilations are given properly, you will see good chest rise and fall. If you are giving ventilations too forcefully, the abdomen will become distended and full of air. The patient simulator has a realistic anatomically correct upper airway, which allows for proper visualization landmarks for placing an advanced airway. If there isn't a need for an advanced airway, an endotracheal tube may be placed to secure the airway. The operator can simulate a difficult intubation by allowing for tongue swelling, trismus, laryngeal spasm, or limited cervical range of motion. The learner has the ability to check certain neural functions and level of consciousness by checking the simulator's eyes. When assessing the simulator's perfusion, you can check multiple pulse sites. Be sure not to press too hard while palpating the pulse, or you may mistakenly assume the patient has no pulse. If you recognize that your patient is missing a pulse and need to begin CPR, you may compress the simulator. In the event of a code blue, you may attach defibrillation leads via snaps from a LifePak 12 defibrillator. Please note the LifePak 12 is a real defibrillator and delivers live energy. The defibrillator syncs with the patient monitor and the mannequin. If required to start IV fluids or give medications, you may do so via the port in the right arm, which allows for the administration of simulated medications. Once again, the simulator can be programmed automatically to respond to the medication and doses given. Final notes when using the SimMan 3G. Remember to wear gloves and to keep ink away from the mannequin's delicate skin. And finally, always treat the mannequin as you would a real patient.